An electrocardiogram or ECG is a powerful tool. It records the heart's electrical activity. Imagine it as a heartbeat monitor. Small electrodes are placed on the skin. These electrodes detect the tiny electrical signals produced by the heart. ECGs are used to diagnose various heart conditions. These conditions can include arrhythmias, heart attacks, and heart blocks. For medical students, understanding ECGs is crucial. It's like learning a new language. It allows us to hear what the heart is saying. ECGs are non-invasive and painless. They provide valuable information about the heart's function. This information helps us care for patients. In the following sections, we will break down the components of a normal ECG. The heart has its own electrical system. This system controls the rhythm of our heartbeat. Specialized cells in the heart act like tiny batteries. These cells generate electrical impulses that spread through the heart muscle. This electrical activity causes the heart to contract and pump blood. The ECG picks up these electrical signals. It displays them as waves and complexes on a screen or paper. Understanding these waves and complexes is key to interpreting ECGs. The heart's electrical system is complex, but we can break it down into simple steps. By learning these steps, you'll be well on your way to mastering ECG interpretation. Think of ECG leads as different cameras. Each camera is pointed at the heart from a different angle. These cameras capture the heart's electrical activity from various perspectives. A standard ECG uses 12 leads. These leads provide a comprehensive view of the heart's electrical activity. Each lead has a specific position on the body. This positioning ensures we capture all angles of the heart's electrical signals. By analyzing the patterns across different leads, we can pinpoint the location of any heart abnormalities. These leads work together to paint a complete picture of the heart's electrical activity. The P wave is the first wave on a normal ECG. It represents the electrical activity in the atria. The atria are the heart's upper chambers. They receive blood from the body and lungs. The P wave is usually small and rounded. It indicates that the atria are contracting. This contraction pushes blood into the ventricles. The ventricles are the heart's lower chambers. A normal P wave should be upright and precede the QRS complex. Any abnormalities in the P wave can indicate atrial fibrillation or other atrial arrhythmias. Section 5 QRS complex ventricular activation takes center stage. Now the QRS complex is the most prominent feature of an ECG. It represents the electrical activity in the ventricles. The ventricles, you see, are responsible for pumping blood to the body. The QRS complex consists of 3 waves, Q, R, and S. These waves are typically sharp and tall. They indicate that the ventricles are contracting. This contraction sends blood throughout the body. The QRS complex is crucial for understanding heart rhythm. Its shape and duration can reveal various ventricular arrhythmias. Section 6 T wave, ventricular relaxation. After the ventricles contract, they need to relax to refill with blood. The T wave represents this repolarization phase. It shows the electrical recovery of the ventricles. The T wave is usually smaller and more rounded than the QRS complex. Its shape and direction are important. They can be affected by various factors such as electrolyte imbalances. Changes in the T wave can indicate myocardial ischemia or other cardiac conditions. It's essential to analyze its morphology for a complete cardiac assessment. Section 7. Intervals and segments measuring the heart's rhythm. In addition to the waves, ECGs also have intervals and segments. Intervals measure the time between different waves. Segments measure the duration of specific electrical events. The PR interval measures the time it takes for the electrical impulse to travel from the atria to the ventricles. The QT interval measures the total time for ventricular depolarization and repolarization. These intervals and segments provide valuable information about the heart's conduction system. Abnormal durations can indicate conduction blocks or other rhythm disturbances. Section 8. Recognizing a normal ECG. Now that we've covered the basic components, let's summarize the key features of a normal ECG. Heart rate 60 to 100 beats per minute. Rhythm regular with each heartbeat occurring at regular intervals. P wave present upright and preceding each QRS complex. QRS complex narrow and sharp indicating normal ventricular depolarization. T wave present and following each QRS complex. Intervals within normal ranges suggesting normal conduction. If an ECG meets these criteria, it is generally considered normal. However, it's important to remember that some variations can occur within the normal range. Section 9. Common pitfalls and Dr. Waleed's expert tips. Medical students often encounter some common pitfalls when learning ECG interpretation. These pitfalls include misinterpreting artifact as a real ECG finding. Artifact refers to interference on the ECG tracing caused by external factors, such as muscle movement or electrical interference. Overlooking subtle abnormalities. It's important to pay attention to even slight deviations from the norm, not considering the patient's clinical context. ECG findings should always be interpreted in conjunction with the patient's medical history, symptoms, and other diagnostic tests. Dr. Mohammed Waleed, a renowned cardiologist, emphasizes the importance of systematic ECG interpretation. He advises students to follow a step-by-step approach, analyzing each component carefully. Dr. Waleed also stresses the significance of correlating ECG findings with the clinical picture. He encourages students to practice ECG interpretation regularly to improve their skills. Remember, ECG interpretation is a skill that takes time and practice to master. Don't get discouraged if you don't get it right away. Keep learning, and you'll become proficient in this essential skill.